Okay, so how many C-sections is too many? Inevitably, whenever I talk about how many C-sections I've had four. Someone always comments, well, my doctor told me I could only have two, or my doctor told me I could only have three C-sections. So how many can you actually have? Well, the quick and short answer is you can have as many as you want. You could have 12 C-sections if you want.
Damn!
Obviously, I would not recommend that. Okay, so why do we even limit the number of C-sections you can have? Well, we always counsel people that each C-section gets a little bit more risky, right? So you have an increased risk of bleeding, increased risk of infection, increased risk of wound dehiscence. That means that your C-section scar can open, increased risk of injury to the bowel, the bladder, any of those surrounding organs. But some of the biggest things that we worry about are scar tissue, because the scar tissue does get worse each time. One of the biggest things we worry about with increased C-sections is the risk of placenta previa or any abnormal placentation, where there's placenta previa, where the placenta is just covering the cervix, or you go into your placenta accretas and your placenta incretas, where that placenta is actually embedded into the uterine wall and can get into the bladder. And that's when it gets really scary, because you may need an emergent hysterectomy at the time of your C-section. So for me, after my third C-section, my doctor actually told me not to have any more too. And I thought I was done, like I've told you guys, and then I just really wanted one more. So we had to have a lot of conversations about how that would look and what precautions we were gonna take. So my third C-section was pretty difficult, right? I lost almost 2 liters of blood. I had to get a blood transfusion during the case, and that was pretty scary. So you would say, after all that, why would you still have another baby? Look, I honestly don't know, and I knew that there were gonna be some risk, which is why we put some things in place. Prior to my fourth C-section, I actually got an iron transfusion, just so I could kind of tank up before my case. We also use Cell Saver, which takes the blood that you lose, filters out the contaminants, and then gives you back your blood. So I actually did not need a blood transfusion after this fourth C-section, which was really great. I also think being active during my pregnancy really helped me. So when we talk about the number of C-sections someone can have, it is really individualized. Now, knowing the risks that come along with each increased C-section, I knew that I was gonna stop at 4. And because I wanted that choice to be taken from me, I asked my doctor to take my tubes out. Now, you know, back in the day, it used to be once a C-section, always a C-section, but that is not the case now. And so I always encourage people, if you've only had one prior cesarean delivery, and sometimes even if you've had 2, ask your doctor about a trial of labor after a C-section, or TOLAC, or a VBAC. To go back and answer your question, how many cesarean deliveries can you have? It's really individualized, and the number is not cut off at 3. However, we know that the risk increases significantly, and I would say that it's not always worth the risk. Look, we know how maternal health goes in this country, and especially when we're talking about Black maternal health. So before you make big decisions like this, make sure that you talk to your doctor about your specific risk factors and make your decision accordingly. So I hope that answers your question. I've gotten asked so many times. Let me know if you have any more questions below.